So this is going to be a video regarding syndrome of inappropriate antidiuretic hormone secretion, also known as SIADH. So you might wonder what this is. So syndrome of inappropriate antidiuretic hormone secretion is a condition in which the body makes too much antidiuretic hormone. The antidiuretic hormone is what helps the kidneys control the amount of water that the body loses through when you urinate. When someone has this syndrome, it causes the body to hold too much water. So they'll begin to feel like they'll be holding water possibly in their legs, in their stomach, or they even hold it around their heart. Causes. So causes, it can be from a number of things. So it could be from like infection, asthma, a brain infection, certain medications could even cause it, or even possibly a hereditary factor. Clinical manifestations, also symptoms. So somebody can have tremors, they could have cramps. It could also cause depression, memory impairment, irritability, or even personality changes. And these personality changes could be combativeness, they could even be confusion or hallucinations. It is important to be aware of these different symptoms because they can all vary from person to person. Alright, so now we have medication, intervention, and other systems. So medications, typically the medications that are going to be taken are known as Lasixes or loop diuretics. So they can be vasopressin, thiazide, or chloropromide, or even like furosemide. The first line of treatment that's going to happen for this syndrome is going to be to limit the fluid intake to avoid the fluid buildup. So medications are what can help reduce the fluid retention. As a nurse for the intervention, you're going to want to restrict the fluids and replace sodium as ordered by the physician. It's important to monitor how much excess fluid the patient has. Because if the patient has too much of fluid overload, it can lead to pulmonary edema, which can be life-threatening. So it's really important to monitor that, to be aware of what is going on. Some of the complications that can come from this syndrome have to do with the low blood sodium levels, and it can cause many complications, which could be headaches, memory problems, even depression, tremors, muscle cramps. It could even cause respiratory failure, seizures, hallucinations, coma, or death. So it can, with the fluid retention around the heart, it can cause somebody to have difficulty breathing, which will affect their pulmonary part of their respiratory system. It could even affect their urinary tract, for how much they're having to go to the bathroom. This is what the medication is used for. For example, they could take a loop diuretic every single day in order to help keep the fluid off of them, because the fluid also makes them hold weight, which can also cause other health issues. And then here are the resources that I got all of this information from.